Welcome back to Central Valley Talk. Obviously, we're coming to you from the Fresno's Tower District. We celebrate what's good about Fresno, and we're going to talk to some people in a minute who are doing a study. Hopefully, we get the cameras set on them a little better. Anybody looking at the cameras? Anyway, there you go. They are doing a study on prenatal care. I actually spoke to them before the show, and I have no idea what they're talking about. So we're going to bring them in, and we're going to find out. I think that's better. Kristin, Carraway,
yes,
and Erica Martinez.
Yes.
And tell me about the study. What's the study all about?
Okay. Thank you again for having us here today. And what we're doing is a research study with Fresno State, and we're partnering with UC San Francisco to compare two different models of care for women. We're wanting to compare prenatal care for women individually, where they go to their doctor for their normal appointments by themselves regularly, with a group prenatal care that's called GLOW here in Fresno. It's run by it's run by Fresno, First by Fresno County, and it's just where women who are about the same gestational age, same place in their pregnancy, come together and do their appointments in a group, and they get additional support, education, they get extra time with their doctor, and we want to see if this has any kind of impact on preterm birth rates, if it's going to help improve maternal mental health as far as anxiety, depression, and then how does that impact their relationship with their provider? Do they have increased satisfaction with their care, perceptions of care?
So a lot of people just go through it with just their doctor. They go to their doctor, they prescribe the prenatal care, they get some instructions and stuff, and then some people go through this GLOW, but it's a group of people going through it together, and you're going to find out throughout the survey, well, not which is better, but what the outcomes are.
Yes, exactly.
Yeah, I think I understand it now. So who are you looking for? We got a lot of viewers out there. Are you looking for people, the GLOW people, are those easy to reach for you guys?
Well, I'm going to let Erica talk a little bit about the recruitment process.
Okay. Yeah, so we are looking for all pregnant people here in Fresno, Fresno County, and some of its surrounding areas that receive their prenatal care with some participating providers. Once they come into their first prenatal care appointment, they will see myself or someone from our team that will approach them and talk to them a little bit about the study. If they are 24 weeks within their pregnancy or less, they will be eligible to participate, as well as they would be willing to do both either individual care or their traditional care that they're receiving or group care. So they would have to be willing to do one or the other, because then they will be assigned to either individual care or group care based on their estimated delivery due date.
Now, why would the, what do you call them, the client, the patient?
Participant.
What participant? Why would they want to do it or not do it? Do they have a motivation?
Yeah, well, we definitely let them know that they will be helping us create, right? Our goal, ultimate goal, is to be able to create a better system when it comes to prenatal care for the women and their families, right? And also, they do get a small incentive for participating. So if they agree to participate, they will be completing a total of 3 surveys with us, 2 while they're pregnant and 1 after they've delivered. And after they complete each one of these surveys, they receive a cash stipend.
There you go. That's what I was looking for. A little motivation there, but they're helping humanity. They're helping the future.
Definitely.
Prenatal care has come so far in the last even 20 years or so. So, and I know you're not in the prenatal care business, but you're more into the survey business, and you're helping get the survey through so we can make better care for the future.
Exactly, and that's why we're actually here. Embrace was actually birthed out of the recognition that here in the Central Valley we have such high infant mortality and preterm birth rates, especially within our African American community. So we had a group of leaders come together and try to identify what are some of the causes, what are some things that we can do, and the group prenatal care was one of the recommendations. So they've already done phase 1 to test it out to see if it's feasible. Now we're going to see what are the differences. So that's where in phase 2, or the research aspect of it.
And I jumped way ahead in this. I should have asked you right up front, what's Embrace?
That's fine. You got it. Embrace. So we're here just to reimagine prenatal care for women. So we're engaging mothers and babies just to try to see what can we do differently to address these different disparities that we have.
Now, who should be calling you? I mean, we have your number up there, your website. Who should be going to you? Is it medical providers? Is it actual clients?
Well, right now, I'm really glad you
Participants,
asked that.
that's the word.
It's okay.
Participants,
We're
that's
really
what
glad you asked that. Right now, the Glow Group Prenatal Care is only offered through the Embrace study, and the only way we're actually able to enroll any of our participants is if they are working or if they're a patient of a provider or a practice that is working with us. So we're really wanting to bring on as many prenatal care providers as possible to the study so that we can have the involvement of as many women as possible.
What, I've been through this a bit, when we have so many guests on our show. A lot of young girls who become pregnant sometimes they're hiding it, they don't want their parents to know. A lot of reasons they don't go get prenatal care. That happens a lot.
Yes.
Would Glow be a chance to maybe take a step into the circle of someone who cares?
Well, we definitely encourage everybody to go and receive prenatal care once they know that they are pregnant. If they do decide to participate or be part of this study, we work very closely with them to keep them safe. Okay. So we do understand how to communicate with them in a way where we know we don't put them in any harm's way.
I guess my question is sometimes they don't get prenatal care because they're afraid at this point. They're afraid to be exposed or afraid to tell their parent, and too many girls wait too long to get prenatal care.
And if they are assigned to Glow, which is the group prenatal care, they will be receiving a lot more support from other women, right, that are pregnant, just like them.
Going
that
through
have
exactly what they're going
Exactly. So, and it's beneficial even to those women that are pregnant and have a great support system at home because no matter how much of a support they have, the people there might not be pregnant like them, right? So they might not be experiencing the same thing that they are. So coming together in a group setting with women that they can share experiences, live their pregnancy, together with, and provide that additional support is great for them.
So somebody watching right now, let's say they're kind of getting what we're talking about, they're not real clear on it, maybe they could go to the website?
Definitely.
Tell us the website. I can't quite see it there.
It's embraceprenatalcarestudy.org.
embraceprenatalcarestudy.org. I'm going to keep that website here at Central Valley Talk. If you're watching, somebody who maybe should talk to them, have them call me. I'll give them the phone number. I'll give them the website. I'll give them all the information. Best if they go direct, of course. And what's the phone number?
So the phone number is 559-5, I can't see from here. 549
4977.
Correct. Yes. And they could actually call and text that number.
Oh, even text the number.
Yes. So whatever works best for them. If they're at work and they can't take the time to maybe give us a call, they can just send us a text message and we'll be able to communicate with them through a text message.
Well, this is going to give us some great information for the future of our valley. We've had, as you said, some prenatal care problems and infant mortality problems, and studies like this help us get to the next level.
Exactly. That's why we're here, and we really want to try to help bridge the gap and reduce the disparities we're seeing in the African American community.
I always tend to hog the interview by asking all my questions, but is there anything I left out that you want to tell our viewers?
It's just we have another year in our study that we're recruiting participants, and the key thing for us is that we really want to bring in as many of our prenatal care providers as possible so that, again, we can reach as many women, and that this is a national study that's really going to bring the Central Valley to the forefront, and hopefully it'll help us kind of give some research and some data that our policymakers will be able to use when they're making decisions on the type of care available to women.
Very good. Kristin Carraway and Erica Martinez. It's Embrace Parental Care Study?
Prenatal Care Study.
Prenatal Care Study. And there's their website, embraceprenatalcarestudy.org. The phone number is 559-549-4977. I'm glad you're doing this, and come back. I want you to come back and give us an update.
Definitely. We'd love to.
Will.
All right. We'll be back with more Central Valley Talk right after this.